No doubt about it. Ensuring the integrity of data in healthcare is critical. Now that you have learned more about the integrity of data, let's take a closer look at some ethical standards that support the Clinical Documentation Improvement Specialist, or commonly referred to as the CDI professional. According to AHIMA, there are 11 standards that are important to understand when working in the field of healthcare. The first of these ethical standards focuses on how to facilitate accurate, complete, and consistent clinical documentation within the health record. The goal and intended outcome is to demonstrate quality care, support coding and reporting of high-quality healthcare data used for both individual patients and aggregate reporting. The next AHIMA ethical standard focuses on how to support the reporting of healthcare data elements such as diagnoses and procedure codes, hospital-acquired conditions, and patient safety indicators. This type of data is required for external reporting purposes like reimbursement, value-based purchasing initiatives, and other administrative uses, population health, quality and patient safety measurement, and research. Each must be complete and accurate in accordance with regulatory and documentation standards and requirements, as well as all applicable official coding conventions, rules, and guidelines. This next standard focuses on how to query the provider, such as the physician or other qualified healthcare practitioner. Queries can be done in one of two ways: verbal or written. The purpose of a physician or healthcare query is to provide clarification and/or additional documentation when there is conflicting, incomplete, or ambiguous information in the health record regarding a significant reportable condition or procedure or other reportable data element. HIM professionals may need to query the provider if the documented need doesn't match the patient's medical need based on their underlying diagnosis or proposed procedure. Remember learning about medical necessity? For example, if a patient is being treated for a broken ankle, a recommendation for a heart-related stress test would not match the medical need of the patient and would be considered unnecessary. Queries could also be required if there's a need for further clinical validation to match the diagnosis with the medical treatment. If the patient with the broken ankle is being recommended for surgery, then the provider may need to provide further reasoning and proof for this recommendation. Queries help to ensure there are no questions when claims are submitted for billing and reimbursement. And a simple query could be critical in catching an accidental human error when it comes to providing the right care for the right patient at the right time. Another important AHIMA ethical standard is focused on reasons why a healthcare professional should never participate in nor support documentation practices intended to inappropriately increase payment, qualify for insurance policy coverage, to avoid quality reporting issues, or to skew data by means that do not comply with the federal and state statutes, regulations, and official rules and guidelines. Bottom line, don't use information or documentation to falsify documents or patient need to receive more money through billing and reimbursement. AHIMA ethical standards also focus on how to facilitate interdisciplinary education and collaboration in situations supporting proper documentation, reporting, and data collection practices throughout the facility. Additionally, these standards focus on how to advance professional knowledge and practice through continuing education. According to AHIMA, it is important for HIM professionals to never participate in, conceal unethical reporting practices, or support documentation practices intended to inappropriately increase payment, qualify for insurance policy coverage, or distort data by means that do not comply with federal and state statutes, regulations, and official coding rules and guidelines. The last of these critical ethical standards outlined by AHIMA include how to protect the confidentiality of the health record at all times and refuse to access protected health information not required for job-related activities, how to demonstrate behavior that reflects integrity, shows a commitment to ethical and legal reporting practices, and fosters trust in professional activities, how to collaborate in team environment with the coding, quality, and other professionals in the organization, and how to report unethical, non-compliant, or unlawful activity to the organization's compliance officer or similar official responsible for monitoring such activities. As a future HIM professional, it is important to know these ethical standards set forth by AHIMA. Abiding by and continuously following these standards will help ensure that we remain a trusted, secure organization of professionals that work diligently to protect a patient's coveted medical information.